Well, I thought I'd start right at 12, but I don't know if this time here is being recorded. So we'll go ahead and get started here. Um, Today we're going to cover Medicare Advantage versus the supplemental plans. My name is John. I'm president of Riley and Associates. We specialize exclusively in Medicare. We are a local independent health insurance agency and here to help you in the Medicare journey. Today's agenda, we will give you it's a quick roadmap. We're running through just a refresher course of Medicare. We'll cover your options, the Medicare Advantage versus supplemental plan. We'll take a look at, how to choose, what those factors should be in making a decision, and then what your clear next steps will be. So what is Medicare? Medicare is a health insurance provided by the federal government for those age 65 and older, and those under 65 with certain disabilities. And everyone is eligible that has paid into the Medicare system for 10 years or 40 quarters, either through themselves or a spouse into the Social Security system. So there's 4 parts to Medicare. We're going to take a look at all 4 parts today. Part A is your hospital insurance. That covers things like inpatient stays and skilled nursing. Part B is your medical insurance. This covers everything else, like your doctor visits, labs, x-rays, diagnostics, and outpatient surgery. Together, Part A and Part B are known as original Medicare. Now, let me get my pointer going here. Yeah, so Part A and Part B are known as original Medicare. So everyone needs to sign up for original Medicare when they first get started, okay? But there's going to be out-of-pocket costs that are not included, and drugs are not included as well, like a prescription drug plan. So we're going to take a look at how we get those costs covered, and we're going to do that either through what's called a Part C or Medicare Advantage plan, which uses like an HMO chassis. It will cover Part A and B and include drugs as well. The other option is going to be what's called a supplemental plan. You're going to stay with original Medicare, Part A and Part B, and you're going to get a separate supplemental insurance plan to cover those out-of-pocket costs, and then you're going to add a prescription drug plan. So those are going to be your 2 options. So let's go ahead and continue on. With original Medicare, like I mentioned, there's out-of-pocket costs, deductibles, co-insurance, co-pays, and there's no out-of-pocket maximum. So if in a year, if you had a lot of expenses, it could be quite a bit. There's no stop loss there. So that's why you get a plan, either an Advantage or a supplemental, to cover those out-of-pocket costs. But let's just say, for example, you have original Medicare, Part A and Part B. You don't get either a supplemental or an Advantage plan to cover those costs. The way it would work is when you go to a provider, you're going to give them your Medicare card. Then they're going to go ahead and bill Medicare. And then Medicare is going to go ahead and bill you for the remaining. So that's what we're going to look at today, is covering these costs. Okay. So this here just kind of gives you a real clear picture of your 2 options, right? Option 1 is Part A and Part B, original Medicare. You would keep original Medicare, but you've got these out-of-pocket costs, your deductibles, your co-insurance. It doesn't include prescription drug coverage, and there's no out-of-pocket maximum. So the way we would do that is we would add what's called a supplemental plan to cover these out-of-pocket costs, and a prescription drug plan. That would make you whole. So this is going to be option number 1. This is for somebody that wants to be able to go to any doctor, any hospital in the nation. You're going to pay a monthly premium. We'll take a look at that here in a minute. So this is option 1. Option 2 is to get your Part A and Part B covered by an individual insurance company. So they would cover original Medicare, and then they would also include a Part D prescription drug plan. This works just like an HMO. It's like an HMO chassis. So if you have an HMO, the Advantage plan is going to work exactly the same. So it works out really well, especially here in Southern California. We have one of the best HMO networks in the country. So both of these options are excellent options. It just really depends on your needs, lifestyle, and budget. And we'll talk about that in a minute. Okay. All right. So now that you understand original Medicare Part A and Part B, which everyone will need to sign up with at some point, everyone needs to get Part A and Part B. Then you're going to get either an Advantage plan to cover those out-of-pocket costs, or you're going to get a supplemental and Part D plan to cover those out-of-pocket costs. Okay, those are our two options. So keeping it real simple, right? So there's two main paths for people to take. First is the Medicare Advantage plan. In the Medicare Advantage plan, you have a zero to low premium. Here in Southern California, most of your Advantage plans are zero premium. There are some with premiums, but most of them are zero premium. Okay. Most of them cover copays for doctor visits, labs, x-rays, all of that usually is covered. With the plans here in Southern California, most costs you're going to incur on an Advantage plan is really in two areas. Emergency, you're generally going to pay $150 copay. In ambulance, anywhere from $150 to $275. So those are going to be your two main out-of-pocket costs with an Advantage plan here in Southern California. Some do have copays for hospital, but most of them don't still. So it just really depends on what your needs are in terms of a plan. But with an Advantage plan, you do have a network. So you have a primary care physician that is attached to a medical group of specialists that's attached to a primary community hospital. So like I said, here in Southern California, we've got UCLA, we have Cedars, we have Torrance Memorial, we have Providence, we have PIH, the list goes on. So we've got incredible doctors and hospitals and a network here in Southern California. So if you like Advantage or HMO plans and you like the low cost, you'll love an Advantage plan. So it's a really good option. And it includes your drugs. So just like you're used to paying on your HMO plan or even the PPO plan, but it includes drugs, copays, right? So it's the same thing here. So it will include your Part D drugs. And the annual maximum out of pocket for most of your Advantage plans here in Southern California, because we do cover other states, but here in Southern California, generally it's going to be $300 to $500 for most plans. Some have $700 or maybe a little higher, but most of them. So I would say 500 is a good average for most of your out of pocket. So you can see that you'd have a hard time ever hitting that unless you got an ambulance, went to emergency, then you'd be done for the year, right? So anyway, really good option, your Medicare Advantage. The other one is your Medicare Supplement. Now your supplement does have a premium, it has a monthly premium. And for most individuals, it'll be anywhere from say $150 to $250, $300, depending on your age and when you come in to the plan. But the nice thing is that you only have one out-of-pocket cost really, which is a $283 Part B deductible, which you would pay at the beginning of the year. So as you went to the doctor or labs or x-rays or outpatient, that you would pay through that $283, which is the copay for the deductible for 2026. And then once you paid through that, then you're done for the year. Everything else is covered. Your doctor visits, hospitalization, everything is covered. So it's a really good option if you can afford the monthly premium. And you've got the freedom to go to any doctor, any hospital throughout the nation that takes Medicare. So you have no network. As long as they take Medicare, you can go to them. So that's a really nice option. And then also, just so you know, for the supplemental, they don't have any say. There's no referrals, no prior authorization. If Medicare pays, they pay. So you don't even get involved, which is really nice. And then you would just add a prescription drug plan. And so if you're not taking any medications here in California, you can get a zero Part D plan. So you'd have a zero premium. And if you're not taking medications, you have no cost. If you have generics, it could be a little bit or zero, even for the generics. And but if you're taking a lot of medications or some big expensive brand medications, then you might have to pay a higher premium for the Part D plan that's going to cover the medications that you are taking. But again, working with someone like us, we do all that work for you up front. And so the plans that you would be getting would include the Medicare, or excuse me, the Part D drug plans. My phone just went off, sorry. So anyway, that would be your option there. Moving on. So you've got two very different paths, but with the option one, your Medicare Advantage plan, you have a zero to low premium, very low out-of-pocket cost, but you would use a network, and it does include extra benefits and drugs as well. Option two is your supplemental. Your supplemental plan, you've got higher monthly costs there on your premium, but very low out-of-pocket costs for the year, and no networks and no prior authorization. Gives you total freedom. So here's just a different way to look at the quick comparison. So for your Advantage plan, zero to low monthly premium, your out-of-pocket cost is extremely low. Flexibility, you do have a network and provider and local hospital that you would use. You would have to get referrals and prior authorization in some cases for outpatient surgeries and that sort of thing. And drugs, your medications are included. There's a drug plan included in the Advantage. The supplemental, on the other hand, you're going to have a high monthly premium. And I say high, I mean 150 to 250, something like that for most plans, depending on your age. And your out-of-pocket is very minimal. Again, with both plans, you're going to have $300 to $500 out-of-pocket maximum. So not much there. Nationwide network, you can go to any doctor, any hospital in the nation that takes Medicare with no, referrals, authorizations, no really insurance involvement there. And then you have to get a separate drug plan. Okay. So those are your two options there. So key factors to consider sometimes, just looking at these key factors, your budget. If you want to keep your monthly costs low, then an Advantage plan might be the best route for you. It also depends on your health. If both plans work really well if you have low, medium, or high health needs. However, if you need to see specialists and it's a chronic extreme health concern and you need to see specialists and throughout the nation, then a supplemental is going to be a better way to go. But both plans give you terrific coverage, and both are really good options there. And then lifestyle, if you travel a lot, supplemental is going to be a better way to go. You can get services wherever you are. And then risk tolerance, both options, very low risk. I mean, $300 to $500 for your out-of-pocket maximum. I don't think there's much of a risk there for either one. So a different way to look at it is just through lifestyles, right? So if you're someone who wants to keep your monthly costs low and you don't travel a whole lot and you're comfortable with the local network, then an Advantage can be a great option. You'll get a lot of extra benefits there too, dental and vision, things like that. The supplemental, on the other hand, if you're a person that does not like rules, prior authorizations, wants freedom to travel, and you don't mind a higher monthly or a high monthly premium, then the supplemental is going to be definitely the way to go. And both, like I said, really good options. Okay. The biggest mistakes people make is maybe choosing a plan based on premium, not looking at other important factors like providers and medications. Maybe they're looking kind of too short term, not looking at the long-term implications of their decision. So those are some of the areas that people will make mistakes in Medicare. And the way to avoid those mistakes is work with a firm like ours. That we specialize exclusively in Medicare. We know all the rules and the guidelines and the different plans and products. So we can help you. We'd recommend you set up a discovery call 3 to 4 months out. That way we can help you plan and get you on a good track and trajectory. we set out, when you enroll in Medicare Part A and Part B, we go through the benefits with you. We go through a presentation that shows your option, explain the basics, that sort of thing. That, and we can do a side-by-side comparison of your employer plan. We have over 2 decades in the employer benefits field, so understand all those plans as well and those rules and guidelines. And then, get, like I said, Medicare specialists, right? There's a lot of rules and guidelines and a lot to know. So having somebody on your side is a huge help. So you've got 2 really good options: your Medicare Advantage, low cost, and you have a network there, but you get a lot of extra benefits. Great option. Second great option is a supplemental. Gives you a lot more freedom. You have a higher monthly premium budget there, but it gives you the freedom to go to any doctor, any hospital in the nation that takes Medicare. Both excellent options, both very low cost in terms of out of pocket. Okay. And then, learn more, right? So today it was very high level, especially just looking at the basics of Medicare, but there's a lot to know about Medicare. There's a lot of rules, guidelines, there is enrollment periods, things that you need to know. So every other week we get into the weeds on Medicare. Today, very high level and just covering your 2 options, the Advantage plan and the PPO supplemental plan options. Those 2 options is what we covered today. But if you want to get a really good understanding, join us every other week and we get into the weeds on it. Okay. And then for us, there's no charge for our services, and we cover most of your carriers and plans. And so we've got 2 different sites that you can visit with Riley and Associates. One is MedicareSouthBay.com. So if you're a consumer looking for help, go to MedicareSouthBay.com for Riley and Associates, and you can schedule a call with me, set up a meeting. We can answer all your questions. If you're a partner, an employer, financial advisor, CPA, insurance agency not doing Medicare, you can go to RileyEBI.com. That's RileyEBI.com and schedule a call there. And there's plenty of collateral materials on both sites for each group here. So anyway, thank you so much for spending this time with us. We look forward to serving you and hearing from you soon. Okay? All right. Thank you.